in Diagonal, Iowa, and tonight I'm going to talk about image quality from a lab perspective and just a few little housekeeping notes. Hopefully you all can hear me, and if you're on the conference call, I believe you can press *6 to mute yourself so that you can't be heard. And then okay. Oh, says I'm muted. Can you hear me? Am I still on?
I can hear you just fine. I can hear you.
Okay, thank you. Well, it said I was muted and then unmuted, so sorry about that. Anyway, back to housekeeping. So one thing, we are going to be looking at ultrasound images, and I know in the lab we keep the lights pretty low so that we can see the images. And at the risk of putting you all to sleep, I would say that if you want to turn your lights lower, then it might help see some of the images that we're going to be looking at. Another thing, if you look in the bottom right-hand corner of your screen, you'll see that the slides are numbered. And so if you want me to go back later to a slide that you've seen and talk about it, then just maybe jot down what number it is and we can go back to it. So without further ado, I think we'll get started. If I can. Okay, so image quality can determine pass or fail at certification. I'm sure we're all aware of that. It can also cause an absentia technician to lose their status, and that is something that has fairly recently been put into the policies for UGC. And then it can also affect the rate of growth of a scanning business. So some of you have really good image quality and you've seen your business bloom and grow, and some that maybe struggle with image quality, it's really hard to get numbers going. And I didn't mention, but this presentation that I'm giving, I actually gave it in Arkansas at the UGC certification in May during the educational program. So some of you that were at that may get to see some familiar slides, but I did put some new slides in. Why is good image quality important? Well, it's very important because of greater accuracy, and I think something that leads to the greater accuracy is if we can have consistency in our images, then, and it doesn't matter who collects the images off of the cattle, and we're all taking them the same, and we're all interpreting them the same, then I think that can lead to greater accuracy. Increased repeatability. Obviously, if the images are really good, then we can interpret them the same time after time, and if the images are marginal, then there's a little more variation in the readings. Fewer rejections. Obviously, we know that we don't want holes in the data. Interpreting is more efficient. We can get a lot more images interpreted in a lab setting if they're high-quality images than if they're marginal images. And on the flip side, scanning is more enjoyable. I know you all have a lot more fun scanning if you know your images are good and you're not going to be marked as marginal and so forth. So tonight, what we will discuss, we're going to look at UGC's scoring system that we would use when we are scoring certification images, and most of the labs, some of the labs use it in-house as well. And we will discuss what lab technicians look for in image quality. We'll look at the difference between a good quality scan session and a poor one. We will thoroughly examine a good image. And you may wonder what image quality and burnt cookies have to do with each other. And I had this batch of cookies that got burnt, and I got maybe some rejections from my family. And anyway, I got to thinking that it's very much the same with having some marginal or rejected images. Nobody starts out saying, gee, I think I'll collect some marginal or rejected images today, just as I can assure you I did not start out saying, gee, I think I'll burn some cookies today. So I think the risk of this presentation sounding very critical or overly critical or harsh, then I just want to put it in perspective. I hope that this presentation will give you something that maybe will improve your recipe for scanning just a little bit. So the UGC scoring system, we use a 1 through 7, and 1 and 2 are acceptable, and 6 and 7 are reject, and then marginals are 3, 4, and 5. And a couple comments, I personally reserve the 1s and the 7s for textbook good or textbook bad. And the marginal images do get interpreted, rejected images do not. That I think everybody's familiar with that. But as you can see, image quality scoring is very subjective. We may see things a little bit differently, but hopefully we can work to be all on the same page. So we're going to start out with Rump Images and what lab technicians look for in Rump Images. And granted, Rump Images typically do not cause most technicians any problems, but and I don't believe Rumps on their own have kept anyone from certifying or passing the absentia certification that I'm aware of. But in the lab, the most important thing is the reference point where we're going to measure. So always imagine yourself interpreting the image and look at the image and make sure that you can draw the fat thickness and that the reference point is there. And then also we want to just make sure that the image is collected in the correct location. I know we know that if you look farther back on the rump, then you will, or if you slide it farther forward, I should say, then you can, no, farther, I'm so sorry, farther back, then you will get the location in the wrong place. You can actually get another reference point even though it's not the true one. So that's what we look for, and we can score image quality deficiencies. We won't go over all of these, but if an image is marginal or rejected, then we will also give it a deficiency score as well, and those are the letters that you'll see associated with each trait. So just real quickly, this is a rump image with the landmarks drawn on it. Now, what I would like you to do, and this is a little bit more challenging without audience participation, but what we're going to do is we're going to look through 2 scan sessions, a scan session 1 and a scan session 2, and I would like you guys to be thinking about which scan session you like the images in better. So here's the first animal for scan session 1. You can see the reference point and the fat thickness and where we would mark it. We can see the floor of the pelvis and coming up to the hook bone. So that's a very good image, and we can certainly interpret that. Next image, also very good. We can see the floor of the pelvis. We can see the reference point very clearly coming up and marking where we would draw the fat thickness. Next animal, still this scan session 1. We've got the floor of the pelvis. We can see the hook bones probably over here. We've got our reference point coming up, and we can easily measure the fat thickness. Okay, another image for scan session 1. We're in the correct location pretty much, and we can see the reference point and mark the fat thickness. And this one, again, looks pretty good, doesn't it? We can easily mark the fat thickness. We can see the floor of the pelvis. Okay, now let's go on to scan session 2. And scan session 2 does appear to be collected in the correct location. The hook bone's probably going to be over here somewhere, but we can see the floor of the pelvis. Now the reference point is a little unclear, to me anyway, as to where I would mark the fat. And the fat lines themselves are quite fuzzy. So as you might imagine, there might be a little bit more educated guesswork involved in interpreting this image compared to the last ones. Okay, again, pretty good location, hook bone, floor of the pelvis. Reference point, again, a little hazy, and fat thickness lines are not crisp and clear at all. In fact, the area that we need is probably the worst part of the image. A little challenging to interpret, and some people may reject it, and that would be perfectly understandable. Next image. Hook bone, floor of the pelvis. The reference point again is a little unclear, and we've got contact issues right again where we need them. Again, marginal image. If some people were to reject it, then I think that could be argued. This one, good location. Reference point, a little unclear. And what I want you to notice here is the fat thickness. Is this the bottom of the fat layer, or is this? And so there's a little guesswork that's going to have to go in to measuring this image. Now, if it were me, I would come right over here and measure it right here. Anyway, little challenging. This one would be rejected. Look here, we've got nice location, but again, the reference point is not clear, and we've got a contact issue. These repeated lines show the contact issue that we have. So, rejected. So which scan session would you rather interpret? And I'm guessing we all agree that it would be scan session 1 and not scan session 2. Before I go on to the next slide, I do want to just point out that Rump image collecting has been trained differently over the years as far as how we collect rumps. And at one time, everyone was trained to center the reference point right under the arrow or right in the middle of the screen. Just center the reference point. And then we were trained to make sure we showed this curve going up to the hook bone. And then we do now train technicians to have a single line. This is okay, the little bit of a double, but a single line. So I think some of you absentia technicians maybe were trained back in the time where it was just centering, but just so you're aware, people today are trained to have the hook bone on the edge of the screen, a single line, and of course the reference point clear. Now I think if you think about scan session 2, I believe this technician maybe was focusing a little bit more on the bottom of the pelvis and the hook bone and not paying attention here. So we don't want you to lose the reference point and the fat thickness lines and so forth just so that you can get a perfect floor of the pelvis, because that's not what we're after. We're after the fat thickness. But we can improve consistency by all working towards that high image quality. Okay, this is just a slide that I put in just to kind of get oriented. Let's say this is the probe, and I know this is very rough, but let's say this is the probe and this is a good image, so it's at the correct angle. If we've got a double line, as in this image, the bottom left, if we have a double line, then that means the probe is too low. So it's at the correct angle, it's just too low. This one over here on the upper right, it looks pretty good about halfway, and then we get the double line. So towards the pin bone is lower. Easy to correct. And conversely, if we have too much scatter under here, we get a lot of scatter when it's too high, it's probably just pointed a little bit too high towards the pin bone. And I know that's maybe a little nitpicky, but that is something that is easy to correct. So in summary with rumps, reference point, always think about interpreting the image and where you would draw the line. I know it's not a hard image to collect, but don't forget about clipping, blowing, oiling over the rump as well. And as far as position, ideally we'll see a single line of the pelvic floor showing a tip of the hook bone and the connective tissue between the biceps femoris and gluteus medius showing our reference point, and we want crisp fat layers. So in a short amount of time, if you're not already collecting the high quality images that we were talking about, it'll be very easy to train yourselves and take perfect rumps, and you'll be scanning just as fast. So now we'll move on to percent intramuscular fat images, or PFAT images. And it's very important, good contact. And that is probably one thing that will affect measurements and image quality a lot. We don't have a lot of position problems, I don't think, for the most part, but contact does seem to be a problem. So we're going to talk about that a little bit more. But we want the animals to be clean, dry, clipped, well oiled in the scan area. And the next one, the even pressure on the probe all the way across, that's a real key. Because I know it takes both of my hands to put the probe on for a PFAT. And my husband, Craig, has large hands, and he can take a perfect PFAT with one hand. So kind of figure out what you need to do to make sure that you have even pressure all the way across the probe. And then also pay a lot of attention to rocking the probe, because if the whole probe surface is not on the animal, then you're going to get more air in there and have poor contact. So pay attention to rocking the probe and even pressure all the way across. Okay, also avoid collecting when the animal's head is up or its back is sagging. The correct location is very important. If you're too high, there's excessive acorn or spinalis. I don't see a lot of that. If it's a problem, it's probably something that is very technician specific or scan session specific. You don't see a lot of those images sprinkled in. Too low, narrow loin depth, I think you see more problems with this, in my opinion, because technicians are trying really hard to avoid the excessive acorn or spinalis, and so they come off the midline and get narrow. The thing you have to be really careful with getting too narrow is you lose a lot of the texture, the even texture. The farther off the midline you go, the coarser the texture and the gets kind of globby. And then too far forward or too far back if the 12th or 13th is not on the screen. And try to avoid blurring. I usually tell people that if you think the image might be blurred on your ultrasound machine, you can be pretty sure it will look blurred in the lab. And just to note with the IMF images, if there are 2 or fewer data points, the animal is rejected. And if there's 3 data points, the animal is marginal. And 4 or more data points, the animal is typically acceptable. And what we do in the lab is we evaluate each image individually, but we give an overall animal score. So this is a PFAT image with the landmarks drawn on it, and this is a list of the deficiencies that would go along with the marginal or rejected images. We won't go over all those because I think we're all familiar with what they are. Okay, so we're back to our scan sessions, and we've got scan session 1, and we're going to look at these images and determine if we would like to do this animal or not. And I believe these look really good. We've got consistent contact and texture throughout. You can look at here at the fat lines, and they're nice and crisp all the way across. We can see the rib tops, 13th, 12th, 11th ribs. So this animal looks really good. Okay, this animal looks pretty good too. We maybe lose just a little bit of contact here. See where the lines get a little bit fuzzy. It's not going to affect where we're going to place the box, so that's great. Probably just a little bit of a pressure thing, but the images look very good. I think you can find something wrong with every image that you look at. But one thing I want to point out while we're here, and we're going to talk about a little bit later when we get to ribeyes, is I want you to look at the rib tops, and this is the ribeye muscle, we know that, but let's look at it, and I want you to notice, and I'm sure you all know this, but I'm going to point this out in the ribeye image somewhat, so I want to make sure we've talked about it. Watch how the LD muscle kind of dips down in between the ribs. So the shallowest point of the LD muscle is right on top of the rib, because that bone is pushing the muscle up. And the deepest point is in between the ribs, which ideally the USDA grader and we ultrasound technicians are going to slice that right in between the 12th and the 13th ribs to get our ribeye area. So I just want to point that out, the trough that this naturally builds. Anyway, good images. Go on to the next animal. Again, we've got good images, and I need to hide my control panel just a second so that I can see all of them on my screen. Again, consistent texture, good contact. I don't see any problem with interpreting that one. Okay, next animal. We've got, again, looks really good. We can make out the striations, the rib tops, the contact's good. We'll go on. Again, this is another really good animal. Again, I'm looking at the contact up here, the texture in here. This one's maybe a little bit darker. You can see kind of a black hole. This one has really nice texture throughout. So that's one reason that we take 4 or 5. And I do want to point out, I don't have images to show it, but it is very important that you understand that an independent image is one where the probe is removed from the animal, push the oil up and replace the probe. That really helps us with getting more accurate PFAT data. So let's go on to scan session 2. I'm hoping that you all see these images and think, oh dear, I hope those aren't mine. And let's look at this upper right image. This is probably the no-brainer kick out. It's got spinalis well over halfway across. The upper left image, we've got some reflections going on, possibly getting a little bit of the acorn spinalis in here. It would be questionable, maybe you would do it, maybe you wouldn't. This one would be a little tougher for me to do because of the fine texture up here, that we're looking at probably some spinalis coming in. So I probably would not do that one, definitely not do that one, maybe that one. And this one, I think, we'd be okay to place the box. So overall, the animal would have to be rejected. Scan session 2, again, another animal. The thing I want to point out with this animal is the contact, especially this image. Look at the difference in texture between the right side of the screen and the left side of the screen. That's a really big difference. It's very dark over here. It's possibly and probably a texture or a pressure issue where the technician maybe is not pushing evenly all the way across. Now over here, we'd want to look at another image to try to help us decide if this is a fat layer or if it's acorn spinalis. And I know I can't hear you, but what image would we look at to check this out? Hopefully you all said ribeye, because we would look at the ribeye image and look and see if we could see the second layer of fat, or if it try to help us determine if it's acorn or spinalis. This one, again, this really demonstrates contact, and we can see contact over here on the bottom left image. In the upper right image, it's pretty much dark all the way across. Look at the difference between the upper right image and the lower left image. And this is the same animal, and it's just improper technique. Now, if you look at this image, we've got nice, crisp rib tops. We can make out the intercostals. We've got pretty good contact, except for the far left. But look at the difference in the upper right with the rib tops. You really can't make out the intercostals between the 13th and the 12th rib. We've got some reflections going on. So I would be pretty comfortable in saying that this is a rocking of the probe issue rather than poor oil. It looks to me like the technician maybe needs to rock the probe to clean that image up. Okay, so scan session 2, another animal. Okay, we'd have to kick the upper left image out because, again, we've got spinalis going almost all the way across the screen. We've got some reflections going on here which if the reflections, if they're truly reflections and they're not where the box is being placed, I don't have too much of a problem with processing and seeing how it processes. But it is something that can be cleaned up, and we've got bright fat lines, but the rib tops, again, are less than desirable. So this would be a marginal animal, and you would possibly do the two images on the right and the one on the lower left, maybe, but not overly fun. So which scan session would you rather interpret? And hopefully we all say scan session 1 instead of scan session 2. Okay, so now let's move on to ribeye images, and we'll spend a little bit more time on ribeyes because I think that is the trait that gives most people a little bit of trouble. And if somebody fails certification or the absentia, then it seems to be linked to the ribeye images. So basically, we would like in the lab, the first thing we look for is just to make sure that the medial end and the lateral ends are both on the screen. We want to see good contact throughout the image, and we really want to make sure that the image is collected between the 12th and the 13th ribs. We would see a little bit of spinalis. If we see a big spinalis, that is a possible 11th, 12th rib, and no spinalis at all is a possible lumbar. And I say possible because no animals are created exactly alike. Excuse me. And it's hard to say in the lab if they are, if it is an 11th, 12th scan or if it is a lumbar scan. But the biggest thing that we probably look at and pay a lot of attention to is that image collected at the correct angle, parallel to and in between the ribs. That is the big thing, and we're going to spend a little bit of time talking about that. So here's a ribeye image that has the landmarks drawn on it. And we'll go to the next one. This is a list of the deficiencies that we talked about that go with a marginal or rejected image. We won't go through all of these, but you know, this list is available if anyone is interested in checking it out. So let's look at scan session 1 again. We're going to look at some ribeyes for scan session 1. And do we like this image? And hopefully we all say yes. And we'd come along, whoops, we'd come along and interpret it through here. We see the medial and lateral ends are both on the screen, got good contact throughout. We can make out the tick marks of the medial end. The intercostals, you can see the break in the intercostals, and you can see the separation here and that they run parallel all the way down, and you can see the transverse process right here. It's a nice full image. It's not flat across the bottom. It's nice, rounded, and full. So good image. Okay, let's look at this image. And again, this this would be an image that I think probably about anybody could interpret. And the medial end's on, lateral end's on. We can see the break in the intercostals, which show us the lateral end. The intercostals are parallel, and notice they're about the same distance apart at the lateral end as they are down here in the middle, and you can see the transverse process. This transverse process that I'm talking about is actually a bone that connects the vertebra to the rib, and it is a bone that will only show up if the medial end is collected directly between, or in the middle of the 12th and the 13th ribs. Now you can have the transverse process and have intercostals running together if your probe is not in the correct location elsewhere. But usually if you can get the probe in the correct location at the medial end, it naturally is in the correct location at the lateral end. Okay, another ribeye looking really good. We can see the medial end and the break in the intercostals to give us the lateral end. And the intercostals are looking pretty parallel. They don't run together. They kind of fade out like they normally do. The transverse process isn't quite as clear, but we've still got a pretty good shape to the ribeye. So this image, again, I think it looks pretty good. We can certainly interpret it. And again, we're going to make sure that the lateral end, the medial end are on the screen. And one of the first things I look at are these intercostals. That is very important for us in the lab to be able to tell if you're at the correct angle or not. And if these intercostals are parallel, which they are, we've got the bottom one and the top one. We've got this transverse process here. Nice full shape. There's one technician that mentioned the shape of the ribeye is one of their landmarks. I mean, we talk about the muscles and the different anatomical landmarks, but one technician said that the shape is actually a landmark, and I think that's a really good point to think about. So let's move on to scan session 2, and this ribeye, it's not so pretty. We've got some contact issues. You can see over here on the left side of the screen the reverberations here. We've got contact issues on the medial end, and we've also got intercostals running together. And just notice, look at the shape of this ribeye. It's not very full across here, is it? It's quite curved up, and that's because the technician is scanning probably a little too straight and not at the angle of the ribs. So I would call it a marginal image because you can kind of make out the medial end, and it would have to be one that would definitely need to be looked at by a second technician. Okay, this would be a 7. This would be an image that would easily get a 7 if it were to come through the lab because it's directly on top of a rib. And we know that because we see the one single line here as opposed to the two separated intercostals. So we know it's on a rib, and notice again that shape when it gets on a rib, then we have a, it's not full at all and it's quite curved the wrong way. One thing, I would probably say this image is collected on the 12th rib because we can look at the size of the spinalis. If there were no spinalis, we could probably say it was collected on the 13th rib. So correct angle, just a little bit too far forward. Okay, this image would be what I would consider a pretty typical marginal image for what would come through the lab. And it would be marginal for the intercostals running together. We've got nice separation here at the lateral end, but then they run together, and you can see this shelf here is we're kind of the precursor to the rib, and we'll look at that a little bit more, hopefully in a video that I've got if it works correctly. So definitely a marginal image. It's definitely shortchanging the ribeye and not showing its full potential. And again, we've got that kind of abnormal curve to it here. Notice how the medial end drops way down here, and then you have to really take a pretty sharp angle to interpret it. So we'd like to clean that one up. This one, I think it's probably a no-brainer rejected. The medial end is completely off the screen. Can't do much with it. Okay, this image, again, hopefully a no-brainer rejected. We have the intercostals here at the lateral end, but then we have a rib. And look over here at the spinalis. If we look at the size of the spinalis, where do you believe the medial end is collected in this image? The medial end is between what ribs? And hopefully you're saying, well, it could be 10th and 11th, or 11th, 12th, and this is probably going across the 12th rib, or maybe even farther forward than that. But again, rejected, wrong angle, and wrong location. Excuse me. So which scan session would you rather interpret? I'm hoping we all say scan session 1. And this is an image, and I've pulled it out of another program, and I want to go to a video real soon, but first I want to talk about this image, and it's a little bit fuzzy because of how I've pulled it in, but I think you can make out the medial end is very crisp and nice definition. We can interpret it easily, and the thing that is a very good landmark are these intercostals. You can see that the separation towards the lateral end is pretty much spot on what it is more towards the middle. We can see the transverse process gives us kind of our medial bottom definition, and look at how nice and full this is. So we were talking earlier about the PFATs and looking at that kind of trough in between the ribs and showing that when you're in between at the optimal distance in between the two ribs, we're at the deepest part, and this image to me would indicate that it is at the deepest part and has a nice full shape. So with that, I'm going to jump out of the PowerPoint for a minute, if you can bear with me, and we're going to go to a video, and this is some video that Craig helped me collect, and we don't have high fancy equipment to gather the images, so yes, the numbers are blurry, but hopefully we can get the idea across. This is showing his hand, and we may play this through a couple times just to look at it, but now we're, okay, he's slid his hand towards the head of the animal, and we've got the single line like we saw in that image before, and this shows us that he is directly on top of the 12th rib. Okay, and now he's going to slide to kind of that sweet spot. He's keeping the same angle, and he just slid in between the 12th and 13th ribs. We've got our transverse process showing up here. The intercostals are parallel and nice separation, and so this image looks really good. Now if he continues that same angle, and notice his hand is sliding on back, okay, now he's on top of the 13th rib, and notice there's no spinalis. It's a little different shape, and we've got the single line that shows us on top of the 13th. So this is something that if you're struggling with intercostals running together or getting that rib in there, this is something that you can play around with a little bit, is getting on top of the 12th and then sliding it back and getting on the 13th and coming back in, and see he's just slid it back in, and now he's got a very acceptable image. So correct angle, you can see that the intercostals are staying parallel, and this is what we want to see. Now something I was going to point out, and I was too slow. Let me slide this back over real quick. Okay, so he just put his probe on, and I can probably even slide it back over a little bit more. Okay, he just laid his probe on, and within 1 second of having the probe on, that image, he could save it and send it in to the lab. So the thing I want to point out there is the preparation and palpating before you ever even put the probe on should put you in the correct location. Now this image could possibly be tweaked a little bit to get the bottom a little fuller, but that is one problem that I think technicians who struggle with ribeye areas, one reason that they're struggling is that they get on and they stay on way too long in trying to correct it, and it's best to pull off, palpate, and freeze that image just as soon as you get on the animal. So that's what I want to look at with that one. Now what I'd like to do is go back to the PowerPoint for a couple slides, and I'm going to be toggling between the video and the PowerPoint, so I hope you'll bear with me. I hope the video will kind of give you an idea of seeing it in action, even though it's maybe not as high a quality of video as I would like to have. But this image, what do you guys think? Do you think it would be acceptable, marginal, reject? I know I can't hear you, but I'm going to guess this image for most people would be called acceptable or maybe barely marginal. You can make out the medial end. The intercostals aren't too bad, but they are running together a little bit. And I'm going to show you the next image. This is the same animal, second image, and the intercostals, look at how nice they are. They stay parallel and nicely separated across here. The ribeye is fuller. We've still got pretty decent medial end contact, and we can see that transverse process. Now, I hope it will go real time for you guys watching this over the internet, but I'm going to toggle back and forth between these images. I'm going to just go back and forth real fast, and I want you to watch this area right here. Okay, see how in our first image this shadow is showing up, and we get rid of it in the second image, and see how it's really pushing, it's making our ribeye smaller. And if we were to interpret these, even though this image doesn't look too bad, it's about a half a square inch smaller than this image. So we'd like to do this image showing the parallel intercostals. And we want to avoid the intercostals running together in the shadow of a rib. And with that, I'm going to jump back out again, and we're going to look at another video here, and it's already going. And I know it's a little bit challenging to see, but this image here, does anybody have, I mean, besides it being blurry, would you feel comfortable with this image, or is it something that you would not want to collect yourself? And just kind of think about it. We're going to come back to it in a minute. But so there's an image. Now, this we're going to be looking at intercostals running together. And hopefully you can see the screen. Okay, so I froze it, or I paused here for just a second, and I want you to watch this area right here. We've got this V that we tend to see when the intercostals are running together. We tend to see a V down here at the medial end, and we're looking at this shadow right here. And if we keep watching it, okay, we got rid of the shadow, and now we're fuller. And our intercostals still, in my opinion, are running together, but not as bad. And now we're going to go back. We've got our, now that didn't freeze very well, but we've got our area right here that we're continuing to watch. Okay. Now, this, I'm sure we all know, is a rib, and we can see the lack of spinalis up here, and you can see Craig's hand, and I'm sure some of you that scan a lot are saying that's too straight. It looks too straight just looking at it, and it is. It's over the 13th rib, no spinalis. But the thing I want you to really watch is watch what the image looks like as it kind of goes between marginal and rejected. There's rejected, there's marginal. Okay, if it were to come through the lab, it could possibly be rejected, but I would probably be more inclined to call it marginal. Look at the intercostals running together. We've got that V, and we've got this shadow here. And we can see as we're watching the video what that shadow turns into. We're just kind of catching the edge of the rib. And now it's very much across a rib. We'll let it keep playing a little bit. And again, the intercostals are still running together. And it's very difficult to fix an image like this while you're on the animal. You almost always are going to have to pull off and repalpate and get back on at the correct angle. But you can see his hand, watching his hand, you can't see it moving very much. But it is moving, and you can see that it makes a big difference. Just a little difference in that image gives us a whole new look. And this is an image that is a little crisper than what we were seeing on the video, but we've got the intercostals running together. You can see the separation over here, and then they're running together to a pretty good point, and we've got this shadow, which we just watched the video, and we know what that shadow is going to turn into. It's going to turn into a rib, and we've got this V, and this is shortchanging the image quite a little. I would imagine sometimes you can be an inch, inch and a half or more difference, and the thing we want to avoid are images like this. Okay, now this, I pulled this out of a different set of software, and I want to show you this image first. Well, no, we'll go back to we'll look at both of them and go back and forth like we did before. Okay. Now that you can see the first image, and I know it's pretty grainy, but how do you think you like that image? Do you think it looks pretty good? And I would say it does. The intercostals are parallel. We've got the transverse process. We can make out the definition and interpret it fine. The intercostals really look very nice. Okay. Then let's look at this image. And this is kind of like the set of two before I showed. But this one, we've almost got the V in here. We've got the intercostals running together, but not bad. You know, this is, again, it's subjective, but I would imagine there's a fairly good portion of the technicians that would maybe score this one as acceptable, and that's very possible. There might be a few of you that would score it as marginal, but if you just saw this one, you could argue acceptable. Now, if you saw this one too, then most of you are probably going to choose to interpret the first one. And one note that I would like to make is this first image, the one that we like better, or the one that I like better anyway, is off of the video. I just grabbed a frame off of the video from the 12th and the 13th ribs where Craig was scanning. He started out and went on top of the 12th rib, and then he went on top of the 13th, and then he went back into the middle, kind of that sweet spot. And this is an image that I grabbed off of this. Now this is an image that you may think doesn't look too bad, and some of you may even call it acceptable, but this image is definitely smaller than the one previous, and the intercostals are running together, and you know, I would much rather interpret that first image. But this image came off of the last video that we just watched with the intercostals running together. So I think that's interesting to note. Even if you kind of try to work to fudge it back looking okay, you're still shortchanging the image if you're at the incorrect angle. So one more short, and I do mean short, video that I would like to show. It has to do, I'm going to start it back over, has to do with contact. Now, if you look at this ribeye image, then you may say, oh, poor contact. In the lab, I may say, well, poor contact, poor prepping. It doesn't look real good. You can't really see the probe, but the top of it, where his finger is pointing more towards the tail, so the face of the probe is shooting more towards the head. And I want you to watch and see how this contact issue is corrected. Okay, it's still pretty poor contact. And now we're getting brighter, brighter, until that looks pretty good. It looks like a whole new image. And if you saw those two images, the first versus this one, you would say, oh, well, the technician pulled off, re-oiled, re-prepped the animal, got it going, or, you know, I might assume that anyway. Maybe you wouldn't, but I might assume that. And this image here that we're looking at on the screen is just a rocking of the probe. We talked about the rumps rocking the probe, the PFAS kind of rocking the probe, and we're wanting to hit the boundaries of the muscles perpendicularly so that they bounce back and give us the brightest image. And it takes a little bit of rocking the probe, slight enough that it's probably even hard to see it. The thing that you have to be careful with is sometimes, like towards the middle of this, sometimes you can get to where there's a rib in there, and this was pretty much on top of a rib, a little bit across, but anyway, that's something that you have to watch. So we're going to rock the probe to where the top of it, where his finger is facing the head of the animal, and the face of the probe is more towards the tail, and it just takes a little bit of rocking to find the proper head-on with those images. So I'm going to try to wrap up for you. I know I probably put you all to sleep, but we're going to just talk about causes for poor image quality, and we'll go over these fairly quickly because for the technicians that have been doing it a long time, this is probably pretty basic. So sun glare, we have to set up shades sometimes. Inadequate facilities, that can cause some challenges, and we can take the best technician and put them in a fairly poor facility or working environment, and there can be some image quality problems. So it does take longer and a little more work. Improper prepping, if you're going to the trouble of scanning, we have to remember that we're competing somewhat with DNA, and we're competing for our customers' dollars that they're using for performance testing, and it really, really pays to take the time to properly prep and palpate and do all that. Some cattle are just hard to scan, and there's not a lot that you can do to get good images. So I guess take your time and take extra images. And the one thing that we don't want to be the cause of poor image quality is the technician's lack of understanding the image quality and what the labs are looking for. So know the rules and the guidelines, clipping the cattle, scanning a squeeze chute, cleaning them, getting the dirt and debris off, just basic rules, weights taken plus or minus 7 days of scan date. Proper electricity and grounding is very important, and we need to reduce interference at least as much as possible, and hopefully completely, but at least in the area where the percent intramuscular fat, the region of interest. And one thing to keep in mind, if you are having interference, then you may need to flip your probe in taking PFATs so that the area where we place the box between the 12th and the 13th rib is out of the interference area. And just know your ultrasound settings and check them frequently. And the Breed Association's guidelines for barn sheets and age windows. So, great technicians see certification as a stepping stone, not a finish line. Great technicians get the difference between an acceptable image and a marginal or rejected image. And great technicians will never settle for good enough. And I am very fortunate to know a lot of great technicians. And I think most all of you are doing an excellent job. And it goes back to the cookies. I don't think we intentionally plan to take any marginal or rejected images or burn our cookies. But that being said, sometimes things happen. And you know, I would just, if anybody has any questions, I would be willing to take some questions. That put everybody to sleep. Well, I do want to say thank you to the Simmental Association for helping us with the webinar and allowing this, and for Dr. Tess for putting these together. I hope you all find it helpful to do the webinars and instead of traveling to a certification. So okay. Okay. Thank you. Right, right. And are you on the conference call, Jolene? Okay, yep. Very good. Well, that sounds good. Do you have any questions or need to go back and look at anything? Okay, we have a question on image 45. Okay. Okay, on 45. You would call it marginal as opposed to rejected? I called it marginal, and it could probably be argued for rejected just because the intercostals are running together so hard, and it's certainly not perfect. But right, right. But it's you know, I would agree with you. It is probably doable. Sure, sure. And that's one of those that it's probably best to pull off and repalpate and try to scan smack dab on top of the 12th rib and see what happens. So, okay, so that was a question on image 45. It looks like we've got Maria. Do you have a question? Let's see. All right, Maria, go ahead with your question. Okay. All right, I can't hear anything.
I know Maria lives in Argentina. It's a long way to go.
Sure.
Hello.
There you go.
Hello, are you listening to me?
Yes.
Oh, great. I haven't any question about all the images that they show us. You are very clear.
Good. Do you have an image in particular that you maybe want to discuss, or?
No.
Okay, very good.
No. I enjoyed a lot this.
Well, very good. I'm glad you were on.
This webinar.
Very good. All right.
There's some questions.
We got another question. Okay. Mike Thompson. Okay, I unmuted you, Mike.
How are you, Becky?
Very good. How about yourself?
I'm doing fine. Is there going to be a chance that we could view this again later? I came in about 5 minutes late, and I would love to sit and watch this again and not just see the PowerPoint, but actually hear the whole discussion and see the videos of you and Craig taking the images.
Sure. And it's my understanding that that we are trying to record this so that it will be posted. Is that your understanding, Dr. Tess?
Yes, we're trying to record them. You never know till it's over how it's going to work, but that's our intent.
I understand.
Last year we had to do it 2 or 3 times to get it to work, but that's our intent. And once we get both recordings from this week and last week where they can be viewed, I'll post the links on the website.
Great, thank you.
All right. Okay. Does anybody else have? Oh, we've got another question from Tommy Shigo. Go ahead, Tommy.
I was just curious. I know you said that multiple times that you'd like to have the cattle standing easy in the chute, not leaning back or pushing forward, etc. How much difference does it make when they're like, I scan a lot of eared cattle down here for Beefmaster, Brahman, Brayfords, etc. I've scanned them upside down with people pushing their backs up. How much difference does that make in rib shape and, for your opinion on it, as long as I hit my markers and find my process, particularly on a rib and particularly, where we break on the sides and it doesn't, I guess, break the integrity of that ribeye, what's your opinion on that?
I would say that the way the cattle are standing on the chute affects the PFATs more than it does the ribeyes, but it can affect the ribeye. The way that the chute is hitting your hand can affect the ribeye.
Yes.
And I would say if you've got your landmarks, the thing that I've noticed is sometimes it's hard to get good contact on eared cattle. And
yes, ma'am.
in one thing that I would pay really close attention to and play around with a little bit is the rocking of the probe, where we were talking about the face of the probe shooting more towards the rear than towards the head of the animal.
Yes, ma'am.
And I would play around with that a little bit, and if you can optimize your contact that way and you're in the correct location, then, it's still tough, I know, but you can usually get doable images.
Well, one follow-up question is sometimes I noticed that some of the Brahman genetics will actually have a top line or a rib shape that is very similar to like our old hogs were from about 4 or 5 years ago, where it's really kind of a groove down the back.
Yes.
So you kind of lose a little contact towards that, I guess, that medial end on it. Any suggestions on how to improve that?
Well, if it's an issue of standoff pad not fitting, then I would suggest taking an image with the standoff pad as best as you can get, and then take an image without the standoff pad as good as you can get.
And just make sure I have the rib fat in the first image.
Correct.
And then on the second image have my landmarks.
Right. You get the image as good as you can with the standoff pad. We would take the fat thickness from that image, and then without the standoff pad, we get the area.
Okay. Thank you, ma'am.
Yes. Yeah. Okay. I don't see any other hands raised at this time. So,
well, thank you, Becky. I think we can call it an evening. Again, we're going to try to record this and post it on the internet so you can view it again.